record. And so maybe, Wendy, do you want to start with an introduction and then I'll pull up the slides?
Sure. Yeah, so I'm super excited to be here. I really appreciate you inviting me and taking a little time to listen to a little talk about vaginal microbiome science and how it impacts women who have either gone through cancer or are going through cancer right now. I am the founder of a few companies. One is Vaginal Biome Science, and we do a lot of work trying to understand how the vaginal microbiome is impacted and impacts the symptoms that we experience vaginally. Um, and so, of course, cancer care really has a big effect on that. I also have another company called Good Clean Love where I learned a lot of this stuff. And we're a consumer brand that sells biomatch products to help women stabilize their microbiome. And I'm super excited and exhausted because we're going to be launching Good Clean Clinical Care. And then I am really going to take a break actually after this. This has been a big push, but that is actually how we're going to be able to bring biomatch into the medications that women are prescribed. So everything from estrogen to pain relievers and steroids that women are often prescribed, but in a base that respects the vaginal microbiome integrity. So I have way too many jobs for an old woman, and the one I like best is educating. So I'm really excited to be here with all of you and share. And some of these slides, I just want to say, are very scientific. And so we don't have to go too deeply into them, but I think some of the people that follow you and that are with you are practitioners, right? And so for them, it'll be more meaningful. But for patients, you might not use the depth of all this material.
Okay, fair enough. Good, good. There. So hopefully you can see that.
Yep. So again, I'm Wendy and I've been working on vaginal health for most of my adult life, mostly because I myself have had vaginal health issues for most of my life. But the more I learned about it, the more I felt like it's one of the most neglected areas in women's health, and certainly one that actually has one of the biggest impacts because we actually have more nerve endings in our vaginal area than anywhere else in our body. And when you have persistent and chronic vaginal pain of any kind or vulvar pain, it pretty much really impacts, and some women might even say controls their life. So, next slide. So the vaginal microbiome is actually a part of the whole human microbiome, and um, and the microbiome starts at our sinuses and goes all the way through to the gut microbiome, which most people have heard of, and exits out the rectal and vaginal opening. What's common to all those places in the mouth and in the nose and in the gut and in the vagina is that it's all mucous membrane. And that mucous membrane is actually carries 3 pounds of bacteria throughout your body, which is either supporting your immune system or actually harming your immune system. And so the vaginal microbiome is a specific community of bacteria because each of those areas has different lactobacillus that protects it. And so in the vaginal area is what we focus on, but I think important to recognize that they're all connected. So if you have a really dysbiotic gut microbiome, which is very common post-cancer, that is really going to affect how your vaginal microbiome responds. Okay, next slide. So the vaginal microbiome, when it's healthy, is really, really critical to the way we feel and how we respond to infection. So when you have a healthy colony of good lactobacilli, that blocks harmful bacteria, yeast, and viruses from taking hold. It also, when everything's working right, calms inflammation. So you tend to not have all these symptoms that you have when it's not working right. So, So when you have healthy bacteria there, you're not going to have the redness and the swelling and discharges that you'll have if you don't have that. And honestly, pre-cancer and post-cancer, um, and having nothing to do with cancer at all, your vaginal microbiome health really does dictate your fertility, your risk of STIs, and just your long-term vaginal health. Um, so whether you even want to have sex or not is impacted by your microbiome health. Okay, next slide.
You're saying your desire to have sex is
Yeah,
impacted.
we've been working on a study for many years, and it's almost done in Nebraska. And what we learned there were things that we didn't even expect to learn about the ways in which your microbiome, just in all the ways the body keeps the score,
Hmm.
actually keeps the score of that really affects your ability to awaken desire or not. It's really interesting. I don't want to get too distracted, but I do want to say that the microbiome, whether it's your gut microbiome, and many of us have heard of this idea of the gut brain. That's your gut microbiome, is
Hmm.
your gut brain, right? And so all the ways that your gut brain is giving messages to your brain, that's true about your vaginal microbiome too. That's also sending messages to the brain. So, um, so yeah. So, again, we're just kind of saying this a different way again, but when the vaginal microbiome is intact, and we call that eubiotic, it's like a built-in security system. Not only does it keep the acid barrier, and the gut microbiome is the lowest pH in the body, but the vaginal microbiome is just second to that. And so your pH is, we like to say 3.7 to 4.1. And anyway, up to 4.5 is probably healthy. But when you get above 4.5, you're going to start to have a lot of bad bacteria growing. And so in that way, by keeping the pH low, you're actually producing hydrogen peroxide and bacteriocins that kill bad microbes. So it is a natural antibiotic. And in that way, again, just referring back to gut biome, we know that when people are sick in their gut, they're not just sick in their gut, right? They get all kinds of infections, or they tend to have COVID or colds or flu much worse, right? And that's because their natural immune system is not working in their gut. Um, and there's a way that these lactobacilli cells work, and that's that they coat vaginal cells, which is that vaginal epithelium, which blocks pathogens from attaching. So yes, if there is a self-cleaning oven, it's actually your healthy lactobacilli that does that. But for many women, and we know that this is true, but we don't know why it's true. I'm going to get to it later. They just don't have the right lactobacilli to protect them. And so this is just kind of the basis of your immune system, whether you're talking about your gut or your vaginal. And honestly, when your microbiome is off vaginally, you're 60% more susceptible to STIs. So it's really actually extremely meaningful to overall health. So these are the BV associated organisms that we think about. But there's also mycoplasma, ureaplasma. There's all kinds of other bacteria that are getting into the vagina from the gut, often that are not identified and creating very long-term problems. Okay, next slide. So I don't want to beat a dead horse, but your lactobacilli throughout your body is what actually maintains your immune system. And every part of your body has a different kind of lactobacilli. So whereas acidophilus might be super powerful for your gut, really in the vaginal microbiome, the native bacteria is not acidophilus. It's more like crispatus or Jensenii, or like I said, there's different types of bacteria that live in these different areas. And what you want to do is biomimic to get the types of bacteria that are native to that area back there. So that's kind of the science that we use in biomatch. And it performs all these functions that are on this slide, not the least of which is that, there's a virtuous circle about the way the lactobacilli produces lactic acid, which suppresses the bacterial overgrowth and which feeds the lactobacilli. So it's like you need, yeah, that's why you need the right ones there.
Mm.
Um, so yeah, Kim calls it the circle of health. Honestly, I'm sorry she's not here. We should have called her in, but she's East Coast time. So I try not to make her work after 7, but she's much more scientific, so she can do more justice to these slides. Okay, she's the chief science officer, so she
Okay.
needs to be more scientific, but we can get her to do another one of these. Okay, next slide. Um, this is kind of an interesting thing, and mostly because we look at what cancer treatment does to shift the microbiome. But the microbiome also changes over the course of a woman's life. And so, as a baby, as a child, you don't really have any lactobacilli yet. I mean, you get coated with it if you have a vaginal birth, but really it's a system that evolves through puberty. And really it reaches its peak during pregnancy. And of course, that's because, it's designed to protect the fetus as well as the mother by having a heavier dominance of crispatus. This is why women who are of color, and again, we know this is true, we don't fully understand why this is true. Their statistics for preterm birth and adverse birth reactions is because they so rarely have good crispatus lactobacilli, right? And again, this is relatively known and yet not at all addressed. We just did a another talk for Black doulas,
Mhm.
and that was really dominant. But cancer treatment is only second to that in terms of what it does to completely disrupt both the diversity and the lactobacilli, raises your pH, creates inflammation. Like it's, all of the different treatments of cancer affect the microbiome differently, but they all create a situation in which most women can't get back to a normal microbiome afterwards. Not dissimilar, honestly, to what happens in menopause. And many women who go through any kind of cancer treatment will talk about being pushed into, for many women, early menopause. And so those states are similar, but in many ways, the cancer state is even more pronounced because when you're using aromatase inhibitors, the estrogen depletion is complete. Whereas in menopause, you have a declining estrogen, but it's not like black and white.
Mhm.
Okay, next slide.
How would I guess and I know this a little bit, but maybe just so it's like on recording, but like what are some signs that women would know that their pH is like in like elevated and like what would be some symptoms that they might have?
Well, all these things that we're saying, right? They're likely going to have an odor. So
Hmm.
when you have a higher pH, that's like a bacteria party setting for bad bacteria, right? Like that's how the good bacteria needs low pH and bad bacteria wants high pH. So when your pH is swinging up, that's when you're going to have more bad bacteria like we discussed on the previous slide. And how you'll know that's happening is you might have pain, you might have different color discharges, gray or yellow or any kind, not natural, right? And also your odor is really off. That's how most women know that something's wrong vaginally, except that for so many women, when they have it for a long period of time, they don't know that it's some illness creating that. They think something's wrong with them. And then they'll use Summer's Eve or some terrible detergent that just accelerates those problems.
Yeah, yeah, that's a good call out.
Um, so, this is a really scientific slide, but, Kim, and you can see all of these are cited and there's citations at the end. But the truth is that if we did treat the vaginal microbiome with more respect and we collected vaginal microbiome data at the time or even previous to diagnosis, we would see that each of these different kinds of cancers has a specific kind of dominance of bacteria that is not normal. So if we saw this a year ahead, we might actually head off some of these cancers, but because we never really look at what bacteria is present in a woman's body, and, just as an aside, even outside of cancer, many women are misdiagnosed 2 out of 3 times for just basic infections. And that again, because we don't look at the incredible indicator that the microbiome is for all different kinds of conditions. But, when, I mean, whatever. I just have always thought this, right? Like cervical lesions, if you were really looking at the microbiome, you would be able to spot that way ahead of before there was the lesions there, right? And if we were treating the microbiome with respect and we're trying to get it back to a eubiotic state, then potentially we wouldn't have the opportunity for these different bacteria to create these cancers.
Yeah. Would you say like an OBGYN is fairly educated in the
Not about
microbiome?
this.
Okay.
No.
I'm just
No,
curious.
I mean, we teach a lot of doctors about all of this, and cancer centers, and like I said, black doulas. And,
Mhm.
it's like the microbiome, when you think about how long it took for the gut microbiome to get into medicine, it was a good 20 years
Mhm.
before doctors started to say to patients, oh, you're taking this antibiotic, you should take a probiotic too, right? Now, probiotics are sold at least as much as antibiotics, but that took decades, right? So we hope that the learnings from the gut microbiome will advance vaginal microbiome education quicker. But it's pretty remarkable how many doctors don't think about the microbiome when they're treating their patients and
Mhm.
even prescribing for their patients because they give them medications based in like petrochemical bases that actually disrupt and destroy the microbiome. So there's a lot that needs to happen in women's health to really be honoring the vaginal microbiome.
Yeah, definitely.
Okay, next slide. So this actually just gives a little bit more color about how chemotherapy, aromatase inhibitors, and radiotherapy impact the vaginal microbiome and vaginal health in general. So when you're having chemotherapy, you're going to frequently have vulvar and vaginal burning and a lot of red inflammation. When you're doing your aromatase inhibitors or tamoxifen, then they're wiping out all of your estrogen. And so there isn't that virtuous circle. And so you're going to start to have a lot of dryness and all of these menopausal symptoms. The tissue is going to be reducing in elasticity. It's going to feel really dry and brittle. Um, and, radiotherapy, especially when it's localized reproductively, can even cause epithelial thinning and the collapse of the vaginal walls to each other, which is called an obliterated vagina. And so yeah, these all require care. And some really good doctors are doing that, right? Like if you're getting radiotherapy and your doctor is not telling you to use dilators, then you should probably get a different doctor. Because you really need to be caring for that tissue. Radiotherapy is sort of like when you burn the roof of your mouth, right? Like, so do you remember when you eat pizza and it like
Mhm.
burns the roof of your mouth and like you can't like feel anything almost?
Yeah.
That literally is what's happening inside your vaginal tissue, right? And so if you don't do anything to support that tissue, it's really terrible what can happen. And not unusually also, right? And you can't even repair an obliterated vagina with surgery. So these are real impacts, and strangely, unbelievably, rarely discussed as real side effects, which aren't even side effects. This is like Erin says, itchiness too. I mean, all of the symptoms that you have that you would expect to have at menopause, you have, and that's like a dryness thing, right? When that tissue is really, really dry. Um, So we have some products we'll discuss at the end that help with all of these things.
Okay.
Okay, next slide. Um, so this is more specifically, it shows you the kinds of reporting that women will say they have vaginal pain after completing radiotherapy. They lack lubrication. I think 50% is a low number.
I would agree.
And 30%, I don't know what study this came from, have consistent, persistent vaginal dryness and inflammation. And so you know, it's, yeah, it's not really just a side effect. It's like literally a new condition that you now pick up from having treatment.
Yeah, I'm just curious, and this is selfishly, and anybody feel free to jump in with any questions at any time. But selfishly, I'm just curious as I'm potentially getting to the point where I might be able to get off of my
Tamoxifen.
AI medicine. I'm on exemestane,
Uh-huh.
but I have had like ovaries removed. So like I'm postmenopausal, but like might be able to get off this medicine this year. Is there like with proper care, is there a way to come back from that?
So like all of our products will help.
Mhm.
There's some new, I don't know, I think it's probably case by case, but there's some new guidelines that really low dose estrogen
Mhm.
vaginally
Yeah.
is safe
Mhm.
because it's local for women in your situation.
Yeah.
And that's going to make a huge difference, right? But if you can't use that, then like I said, we're going to come back to some other products at the end of the deck that actually do have made a big difference for a lot of women.
Yeah.
So you don't have to live in this kind of pain. There are solutions, and it's not. And I don't want to say that we're going to solve the problem. It's going to go away forever. Only so long as you use the stuff does it feel better,
Mhm.
right? So it's like just the same way you take care of your face. You're not going to stop taking care of your face for like you just do it for 5 days and then you stop, right? Like it's
Mhm.
the same kind of self-care routine that you adopt for your vaginal health.
Yeah.
Okay, next slide. Um, so this again is Kim being super scientific about these studies of how all of these different types of treatments and post-treatment affect your microbiome, and not only your vaginal microbiome but also your gut microbiome, where there's quite a bit more studies and evidence. But if it's affecting your gut microbiome, it's also affecting your vaginal microbiome, right? So these are interesting studies. Again, they're all cited at the end. I'm not gonna read them out because you'll have this deck and people can
Mhm.
read them themselves. But I just want to say that there is evidence, studied evidence, that endocrine therapy, chemotherapy, and radiation actually wreaks havoc on the function of your microbiome. Chemotherapy, gut brain microbiome link gets broken, and I'm sure many of you who've had that experience, know this personally. So I don't know if this helps you to know that, science like actually is certifying your experience that
Yeah.
these treatments are really harsh, really, really harsh on the body and its natural immune system.
Hmm.
So everything you can do to rebuild that is really like the only rational response.
Yeah. It's
Um,
certainly not, you get your pamphlet of like, this is my chemo drugs and these are the side effects and this is not,
they
not
don't even include
included.
it, right? They don't even include it. I know, it's incredible.
Yeah.
And they probably don't even talk about your gut either, you know?
It's just what you, yeah, they're just eat whatever
I
you.
mean, which actually don't get me going about Western medicine because you don't want me to
Fair,
be on that soapbox.
fair. Yeah.
But yeah, at the end, I'm going to tell you how I'm trying to elevate
Okay.
Western medicine a little bit. Okay, so next slide. Um, so this is an important slide because it shows, and so these are like some product names, and so osmolality is so if you remember from chemistry in 11th grade, osmosis, and so the job of the cells is to balance what's inside and outside of the cells. And so when something way heavier is introduced to a cell wall, what happens is it pulls all of the moisture out of the cell and the cells slough off. So our products here at the very bottom and human fluid are what you call isoosmotic. And then as you go up this scale, you see KY warming is 30 times higher than your natural fluid. And so when it's that high, this diagram on the right shows you this is what your epithelium looks like. This is like the test, sort of the normal. This is just a normal cells, and then here's with good clean love, and then here's CKY warming on the bottom. There's like no cells left. And so in 4 hours, that's what a hyperosmolar product can do to your vaginal lining, your vaginal epithelium, which is that top layer of protection that we talked about in your immune system for your vagina. So, and even Kim added this in, we've even see that with vaginal ultrasounds that use really toxic hyperosmolar products, there's a prevalence, increased BV risk within 1 to 13 days. And this we see this histology study on the right is within 4 hours. So that's why, like, even if women get an estrogen replacement, but it's in a petroleum-based product, then it's not really going to be able to do everything it's supposed to do because it's also creating a totally dysbiotic environment in your vagina. So anyway, next slide helps to clarify this a little bit. So osmolality is the measure of heaviness that that your cells can take. And so really you want to be isoosmotic, which is at the bottom. But you can see these products that sort of are much more hyperosmolar. And then, here shows the range, where you really want to be between 3.7 to 4.5. And, that we're the only ones making products that meet both of those conditions, which is what we call our patented biomatch technology. So anyway, the next slide is going to help us to understand how we built this idea of biomatch. So again, osmolality means we're not doing any harm. We're not disrupting the vaginal microbiome, and we're not actually causing the vaginal epithelium to shed, right? It's just like the water stays in the cells, and we're not disrupting, right? So first, do no harm, and because we do no harm there, the second pillar of this technology is that we reduce the pH to the right level so only healthy bacteria can live there. And just by doing that, right, that's the natural mechanism that your body would actually do if it had the right bacteria. It would actually be reducing your pH continuously. But because so many women don't have the right bacteria, we also, in this technology, add a type of lactic acid, which helps the healthy bacteria, like it feeds them and it helps them to continue to thrive in that environment. So this biomatch technology is in all of our products, and many women can come back to a biomimic state of wellness by using them. So that's how we restore the vaginal microbiome. It's barely science, honestly, but I did learn it from a biophysicist at Johns Hopkins, and I am really a good student. And so once he taught me these secrets, I started making all our products this way. And it is the thing that separates what we do from every other company in the market. Okay, so next slide. So this is the products that usually we send out to cancer clinics and doctors who work with cancer patients. And I think there's some kind of kit online
Mhm.
where you can buy these together. So the Rehydrate Gel is a moisturizer that you would use every night. We designed it actually from a request from an oncology doctor who said that they don't have anything they can give their products that's tolerable. And so it's very gentle, and it has hyaluronic acid, which increases the cell's capacity to hold water. Um, and it's also bringing your pH down to where it belongs at 3.7 to 4.1, and also providing that lactic acid. So when good, healthy lactobacilli shows up, it has something to eat. The balance wash is 60% aloe and uses all the same technology in an external wash. So for women who have a lot of vulvar conditions, which happens frequently with these symptoms, with cancer treatment, balance wash is frequently enough to help them. I think combined is the best way to use it. Um, and then we also have this relief gel, which is the most popular sample we give out to doctors. It's also in that same biomatch base, but it delivers 4% lidocaine, which is actually the same prescription strength that many doctors give, but that's in a petrochemical base. So a lot of doctors prefer this. But this combination of products is going to help you to start to restore your microbiome. And then we also have a suppository that's called Reset that we didn't include in this slide because you know that would be more for you, Ashley, after you're getting over all this, that you would start to want to bring this native lactobacilli that's in the suppository back in. And so you can start to see that good, healthy bacteria there. Because you might not get that back after all your treatments,
Mhm.
right? But you can put it back in, and you can just put it back in once a week or twice a week, and you'll have the same experience as had that bacteria come back to you. Okay, next slide. So these are the most common symptoms that women talk about or try to address. So vaginal dryness is, and again, I want to say this is a extremely common symptom for women in perimenopause and postmenopause. For sure, every single woman probably that goes through any kind of cancer treatment also has vaginal dryness. And you know that affects elasticity and creates itchiness and does all kinds of things. Because of that, and because of the tissue damage itself, many women report pain with sex. Um, but you know, the good thing is if you're doing daily hygiene with your vaginal microbiome and using this gel and wash every day, which I do, I just want to say that's like nightly routine for me. Um, then you tend to start being a little bit more moist, not so dry. And so then when you add a lubricant during sex, it actually can help you even get to pleasure, right? Like you don't want to just wait and use the product when you're having sex, right? You want to be really supporting your vaginal health every day.
Mhm.
Pelvic floor therapy, you know, a really good doctor will tell you, and they've told me many times, that until you really work with your pelvic floor, you can't really resolve other vaginal issues long term, because your pelvic floor is trying to protect you, and in the course of trying to protect you, many of the muscles become either over tight or overly relaxed, and all of that can kind of be part of the reason you're having recurrent infections or incontinence or other things. So, you know, if you've never talked to or thought about pelvic floor therapy, you know, they make up a huge percentage of our care base on our Institute for Vaginal Health. And many women find great relief from that. So I really recommend it.
Yeah, we've got Erin. Erin is a pelvic floor therapist on here, so she can attest to that for sure.
Yeah, I mean, there's probably not enough pelvic floor therapists for all the women who need pelvic floor therapy.
Yeah,
But if you really look, most cities have at least a few pelvic floor therapists.
yeah.
Um, next one, next slide.
Oh, those are the references.
Yeah, so there we are. And I don't know, is the slide after this? Is there another
Uh,
slide?
I don't.
Okay, well, so we didn't give you the right deck because The next slide should be about the good, clean clinical care.
I have
Um,
one
and
more, but it talked more about the intimacy part. Is that the one that
we can talk about that, or if we want to take a moment and have anybody ask questions, or I saw
yeah.
there were a couple comments. Um, but so the exciting thing is now we're going to be able to bring this technology into vaginal medicines. So if you need estrogen, you can get it in a biomatch base on this new website we're opening. Or if you have a really great doctor, your doctor can also prescribe this directly to you off of our prescriber platform. So whether it's an estrogen cream or a lidocaine cream or a pramoxine cream or maybe, a steroid, mometazole, getting it in our base, I think is going to be a game changer for many people. And also we'll have other therapies on there to help you restore your microbiome, as well as the Good Clean Love products that I showed you earlier. So I've been killing myself to get this done. We're hoping that we're going to launch it beginning of April, and I really hope it's going to make a big difference for cancer patients.
Hmm. Yeah, amazing. Um,
So was there a couple questions or
I think
comments that I
Aaron had some
missed?
supportive commentary in here. Valerie started pelvic floor therapy a few months ago. Good.
Hmm.
Definitely. Does anybody have any questions or just anything, thoughts?
I kind of went, I don't know if I went too fast, but
No, I think
um,
it's great.
and I'm happy to visit the intimacy slides if people want to do that, or we can do it on another day. But of course, all of these symptoms really does affect
Mhm.
your interest in and ability to really enjoy intimacy after your treatment.
Yeah.
Um, so there are things that can be done to approach that. I think certainly all of this reparation and about your vaginal microbiome and your vaginal health will
Mhm.
make you start to think about that again. But I think there's some interesting slides about that too.
Yeah, I mean,
So,
it's definitely we learn so much about like you have dryness and but you don't really understand like why and like what that means and like so just hearing that's all related to the vaginal microbiome is very interesting.
yeah. So Erin just asked thoughts about probiotics for vaginal health. Um, so, so let me say that there are studies that show that some probiotics can get through the gut and out the rectum and populate in the vagina. But that's how they get there, right? They get processed through your digestion and then come up through the vaginal opening, right? So I feel like the way we do it is we put native lactobacilli in a suppository, a capsule, which you could. I mean, if you took our capsule orally, it wouldn't get to your vagina because we don't coat it. The probiotics that potentially could work have this enteric coating, and what that means is that it gets through your microbiome in your gut, right? Like the idea is that the lactobacilli survive your gut acids to exit through your rectum. Um, so, there's a couple brands that I, admire I mean, there's many brands that do vaginal probiotics orally. I think the raw probiotics, vaginal probiotics, are pretty good. Um, but there's a million probiotics in the world, and not everybody's even using the right or the strain that's going to be most helpful for the vagina. So, just be conscious when you purchase those. Um, but I think it's good to just put them in so that they go right where they're supposed to go.
So the suppositories that you all have the lactobacilli in them.
Yeah, that's basically what the suppository is. It's a lactobacilli, no different than really if you take one orally, except
Mhm.
that we really recommend to put them in vaginally so
And
that the bacteria can get right where it's supposed to be.
is that like I mean I thankfully have a doctor who supports estrogen, like I have an estrogen suppository. Is that something that you could like alternate? Like,
Yeah, because you'd only want to do that. And if you have estrogen suppository,
mhm,
that means that that estrogen is doing that job, right? Of like creating glycogen, which the lactobacilli need to keep going.
mhm.
So you maybe only do the suppository once a week, and you're gonna smell the difference in your vagina. Like as soon as you have healthy lactobacilli living there, it like really smells different.
Interesting. Got a question on lubricants on the website.
Good Clean Love website.
Yes.
So I think for like the one I would recommend for cancer patients is the BioNude because that is the one that is most biomatched. The aloe based product, we have a couple. One is called Almost Naked, and then there's one called Hint of Mint or something, but they're both essentially a 95% aloe product. And I think aloe does a lot of great things to support lactobacilli too, that we also know. But some women who have a lot of sensitivities might react to that aloe at a low pH. So that's why we always recommend the BioNude for women who already are sensitive. Another product that we just launched this year and that is really beautiful is the Naked Coconut, which is a coconut oil hybrid. And that one's actually maybe a little bit longer lasting than the BioNude. Um, but using again all the same biomatch principles, and has a nice coconutty smell. It's kind of sexy and is maybe a little bit more viscous. So I don't know, does that help a little bit? I love all our lubricants. Lately, I've been using the coconut hybrid because it's really nice. But for a long time, I was just using BioNude. But
Another.
can you talk a little more specifically about what we should and shouldn't be using down
Ooh,
here? I think,
that's a good one.
yeah. For sure, like I mean, here's the thing. Like I showed you that chart about hyperosmolar. And so, if the ingredient deck of anything that you're using is got a propylene glycol or polyethylene glycol or methyl and propylparaben, if it's things you would never bring in your kitchen, you probably don't want to put it on the most sensitive tissue in your body, right? Because it's hyperosmolar. So, honestly, the only wash I ever use, and most people, who use our wash, once they start using it, they never use anything else. That's literally the only wash I use all over my body because I know that a lot of saponifiers, that's like things that make suds and wash, are extremely harsh. And and so you just don't need that. And actually, this is why a lot of doctors will tell you that your vagina is self-cleaning. Don't use anything to wash. But truthfully, most women need something to wash away the detritus. And so I think about our wash as more of an aloe rinse. And honestly, try it. Like, see, tell me, does it work for you? Most people really feel like it does. Um,
I was
yeah,
just
so
putting
there's a
the,
code for you.
yeah, everybody know we have a
So,
code.
so thanks for that. And maybe you could add it. So the code is Rebuild AB 15.
Hmm.
So you can take that and use that on the site. And I'd love to hear your perspective and how you feel about it. So essentially what I do is get balance wash, use it every day. I'd get the Restore gel is a nightly gel, but that's the aloe gel, very similar to our aloe lubricant. So the one that's really designed more for people who've gone through the terrible things you've all gone through is the Rehydrate. So the Rehydrate, and then the Reset is the probiotic suppository. You just want to use that once a week, and that's all you need to use. And then a really nice lubricant, one of our lubricants when you want to have sex. And literally, that's all you should have in your vaginal closet. Douches, like everybody says, no, so actually, we never wash in the vagina, right? What we do instead is we put a gel in the vagina, which does the work of moisturizing and bringing healthy bacteria and bringing the conditions for healthy bacteria. So that's what people don't understand about douches, right? You're actually washing away all of your healthy bacteria when you use that. And because they're mostly chemicals, you're also really disrupting the microbiome again with like those massengill douches. They should be arrested, those people. So please don't douche. And
Mm.
also don't steam. Like, honestly, I do TikTok videos. I don't know. Most people think I'm ridiculous probably, uh, but my most popular TikTok video is about don't steam. And
What is steaming? I don't think I've ever
well,
heard
I don't
somebody
know,
say that
people
before.
like will sit on a steam thing where they can actually get third-degree burns. So there's that. And but you don't need to steam the inside of yourself. Just use the gel and that will work, and so the wash is for external, it's for vulvar. And then the gel is internal, and then the suppository once a week, and you'll be set. You'll be like, oh my God, my vagina is back. Here I am. And if you need an antibiotic, think about going to Good Clean Clinical Care where you'll get the same treatment with the medicine. Or
Mhm.
if you really need a steroid, because sometimes women go through periods where they really do need steroids. Or if your doctor thinks it's a good idea for you to use some estrogen cream, really low dose estrogen cream, also available soon on clinical care. And your doctor can prescribe those things directly on what we'll have as a new prescribing platform. So if you have a really great doctor that you love, just tell them about it, and they can do it for you.
Mm. And yeah, we'll definitely be sharing once we hear more from you about the launch of that. We'll be able to share that out as well. So,
Yeah, yeah, for sure. So yeah, just don't use any chemicals. Don't use any other brands, that I mean, I can't, there's a couple of other brands of lubricant that are very similar to our organic aloe lubricant like aloe cadabra. I mean, it's essentially a very similar product, right? There's another company called Yes that makes really clean microbiome safe products. Um, so I'm not saying I'm the only one that does it,
mhm.
but I'm the only one that does it scientifically anyway, and really dedicated to working with scientists. And, just as an aside, we're running a study right now nationally with all the doctors we work with to take microbiome data at the moment of diagnosis, so that we can really see what the microbiome has to say about those diagnoses. So we really are trying to be not just selling you stuff, but making stuff based on science and really trying to further the science of vaginal health.
Yeah, that's amazing.
Yeah, so anyway, that was a lot of talking, and I apologize if I talked your ear off, but
No, I think it was very insightful and I appreciate it very much.
so hopefully people will like it and watch it,
Mhm.
and if you want, we can sort of schedule another time soon and talk about intimacy.
Yeah,
Um, and if people are up for it, but I feel like once their vaginal health is better, they'd be more interested in thinking about sexual health.
yep,
So I don't
agreed.
want to push sexual health on anybody if they're not feeling vaginally well.
Agreed. Agreed. Amazing. Well, thank you so much, Wendy. We appreciate
Yeah.
it.
Yeah. Thank you,
All
Ashley,
right.
for having me.
Yeah, of
And
course.
we'll be in touch, okay?
Yes, sounds good. Thanks, everyone.
Thank you.
Bye.
Bye.